Hi everyone, today's lesson is on STYEs, which is also known as hordeolum. So today we are going to talk about eye STYEs in this lesson. What causes them, different types of STYEs, and regarding signs and symptoms of STYEs and how to treat them. So STYE is an acute bacterial infection of the eyelid. There are actually two types. There is an external hordeum like external STYE and internal STYE. So now eye STYEs are relatively common condition and there isn't a lot of epidemiological data looking at the differences in prevalence between different types of STYEs patients. It is known that there is a higher prevalence in adults versus children. So now let's talk about the pathophysiology of getting a STYE. So a STYE is going to occur at an eyelash follicle or at the margin of the eyelid. So what's actually going to happen is that there is going to be a stasis of glandular secretion. So you have all these little glands on the margin of the eyelid, and what's going to happen is those glands will become clogged or blocked for some reason, and the different types of glands that can be affected include Zeiss glands, mole glands, and meibomian glands. So each of these glands actually secretes different types of products. So as eyes glands can secrete sebum and other antiseptic products that can help to reduce or fight against the bacteria. Mole glands have similar immune functions, and meibomian glands are going to be modified sebaceous glands that help to lubricate the eye as if there is stasis or some blockage or clogging of any of these glands. What can happen is there can be a secondary bacterial infection. So if there is a blocked gland, bacteria can get into that gland and cause an infection. This is how we can get a STY. The most common bacteria that is going to cause an infection is Staphylococcus aureus. So once again, one of these types of glands is going to become blocked or clogged. So it's not going to be able to secrete its glandular products, and then it's going to lead to a secondary bacterial infection with Staphylococcus aureus, and this is going to lead what we call a STY. The external STY is that little pus-filled raised lump on the eyelid, and the type of glands that are affected in external STY are going to be the Zeiss glands or the mole glands, and again it's going to cause this external raised pus-filled bump on the outside of the eyelid. So in internal STY, meibomian glands are get affected. So now let's coming to the clinical features of the STY. So the first symptom is a painful inflamed eyelid. So inflammation of eyelid is present, and there's going to be a red swollen lump as we talked before, which is going to be a pustule. You can see a white in it, so that's a little small focal abscess. Whereas in internal STY, you will actually see big red swollen lump or a bump on the inner part of the eyelid. Now coming to diagnosis is by simply seeing the STY, it is going to be enough to make the diagnosis. So physician will look at some history and physical examination, that will be how it is diagnosed. And coming to the treatment part, this is often a self-limiting condition, so treatment is not necessary. It's often going to resolve on its own, and it usually takes 1 to 2 weeks. There can often be spontaneous drainage of STY, so the STY can simply break over time in that pass, and that other bacterial debris can be drained from its own. So what can help with treatment is having a warm cloth with gentle compress. So using a warm cloth with clean water and a small little gentle compression on the STY can help you in removing some of that debris. In some cases, if it's very large STY or if it's not resolving on its own over a certain amount of time, topical antibiotics with erythromycin may be used. And in more severe cases, incision and drainage by an ophthalmologist may be employed, where this is where an ophthalmologist will come in, put an incision and drain this STY, what is going to be in cases where there is a severe infection. And let's have a look at some homeopathic approach towards STY treatment, and it is very useful homeopathic medicines for STY and safe and effective with no side effect. The first drug of choice is heparsol, which aids in speeding up the rupture of STY so that the pain is instantly relieved. Stephysagria is also very effective homeopathic treatment in treating the STYE. It is chronic or recurrent STYEs that appear mainly on the upper eyelid. The eyes are very dry and have rheum. The corners of the eye and edges of the eyelids may be chapped and infected. So that's all for today. So do check out my other videos and do share this video with your friends and relatives. And if you haven't already, please like and subscribe for more lessons like this. Thanks much for watching and hope to see you next time.